Okay, just as I mentioned, note one. Yeah, you probably see me upload yesterday's video today due to upload conflict and timing. Second, due to risks and the possible way for please do noted by Dr. Peter Juni and other doctors and healthcare specialists, not the government. So, please do not have any gatherings of large gatherings until we actually reach phase one, which I think will happen on the Saturday after June 2nd. Just by my assumption, because they always the second lockdown was started on a Saturday. The second stay-at-home order started on a Saturday. You see where I'm going? Yeah, could be Saturday. So I'm just going to so of course whenever they have there's a holiday or statutory holiday as they call it, or a break day. So they're going to combine the coronavirus cases. Two. It's reported two today. So first off, so Victoria Day. So the cases was at 1,446. Okay. And today is at 1,039. Okay, so that's lower. Okay. Monday's case reports, 325 was from Toronto, 390, and Pure Region was at 393, 325 from Toronto, and 97 from York Region, and 78 from Durham Region, probably because of that car rally, and I mentioned, and yes, so which apparently happened on Sunday in Pickering, and Pickering mayor, Ryan, he's not happy. No. Dave Ryan, he was not happy about that one. So, and in today's report, Toronto takes over again with 387 cases, 231 from Peel Region, 77 from York Region, and 60 from Durham Region. So it's just Toronto, Peel Region, York Region, and Durham Region that's been on this list for the last couple of days. And usually Ottawa or Hamilton or Halton Region is on this list, but apparently they're not. And of course, that was a rare occurrence where London Middlesex region was on this, and Niagara, But, so all other regions reported under 60, apparently, compared to the 2 days. So the death number right now is like 8 deaths were reported on Monday, and 33 deaths have been reported on today. So that's bad news there. So variant cases. So, of course, the UK variant is the most dangerous threat we have right now. At 120,130 cases, an increase of 985 for the last 2 days, including today. 817 South African variants, plus 9. 2,462 Brazilian variants, which is a plus 40, and the India double mutant variant has not been updated by the government, the provincial government, even though it is a variant of concern, so which really annoys me. Why don't they? So that's the the last number given was 45. Although they updated the Brampton's number, which was originally at 36. Ottawa's number was at 141 with 2 deaths. And of course, there's no mass screening to detect the India double mutant variant, which is just stupid. So, you want to book a vaccine, you can do it online, covid19.ontario.ca/book vaccine. By phone, 1-888-999-6488. At a pharmacy, you will have to wait though. You will have to wait at least from 1 week to 1 month. That's annoying. So if you're 18 plus, you can do that right now. So that's for youth 12 to 17, which started Sunday. So they can they can do this through the provincial portal, pharmacies, special dedicated youth and family clinics, and also at pop-up clinics, mobile clinics, and walk-in appointments on Tuesday, especially. So today, you can do that. So youth in Pure Region, Lambton County, Guelph, Chatham-Kent Region, and York Region have already been allowed to do this since last week. So good for them for not doing that, because. So youth not aged 12 as of Sunday. So if they're 11 or under, so under 12, so they can book an appointment for a later date through 1-833-943-3900 or through the public health units or the local health unit. So they allow that. Stay home order ends June 2nd. Now, my first thing, of course, I have the 3-phase rule down below. But the first thing I want to talk about is the Moderna vaccine. So, Moderna Incorporated says that the coronavirus vaccine shows 100% efficiency in teen, youth age 12 to 17 apparently. So okay, this is and apparently there is no new or major safety problems in a clinical trial, according reported today. So this really gets the youth ready for the summertime. So they got to get their vaccinated. So Moderna Incorporated, which the vaccine is authorized for adults at 18 and up. So they still will submit the findings of the adolescent study to the U.S. Food and Drug Administration and other regulators for emergency use authorization in early June. So when the USA regulators took about a month to review a similar study from the Professor BioNTech vaccine, which is authorized for the 12 to 15 on May 10th. So if the Moderna vaccine also gets the same treatment, the authorization starts sometime in early June, so that's good news. Although there's a claim that most children with COVID-19 develop only mild symptoms or no symptoms, yet children remain at risk at becoming seriously ill, and they could spread the virus. So vaccinating this could be a big improvement. So we might have the Moderna vaccine available for use 12 to 17 sometime June. That's alongside the Professor BioNTech vaccine, so that's good news. Now I want to talk about schools. So there was like a request from from people including that were healthcare professionals and people who work with children problems and sick kids in Toronto and Children's Hospital of Eastern Ontario and Ottawa also they also joined in and tried to push the Ontario government to reopen schools. But someone uploaded some flaws about it. I'm looking at it right now. So someone named Mike uploaded this, shared this. So he said, with all due respect, if sick kids and others advocating for return to school for 1 to 2 weeks, where kids will be masked in rooms with no air conditioning, including scorching hot portables, because some schools have portables, and yeah, they're very uncomfortable. Want to be helpful, maybe redirect your advocacy to a safe September, because if you think about it right now, the weather is like literally warm right now. Like people are wearing walking around in summer clothes, like maybe shirt, t-shirts, shorts, and and there's sweat in buckets. So if you're in an enclosed like an area for like quite a long time, of course you're going to get like it's going to get hot unless if you like some way to let the breeze in. But can we? So apparently some people have replied, and some teachers have said no. So even though they could try to open the windows, of course hot air goes in. So it's like, and even though like kids would be like wearing masks for like safety reasons, of course. So and of course there's some mention of mental health issues. And then some person that mentioned that not so fans are not permitted in many school boards. So imagine 30 degrees Celsius hot day, or maybe hotter than that. Yeah, that's so I'm also some lady named some teacher named Tracy, who was a teacher. So she was apparently her classroom's on the top floor with no air conditioning and grates on windows which barely open for air. So, and she teaches 22 students. So they're crammed in there. So, and she's opening for a safe opening in September instead of opening right now. So. And someone also mentioned they're not thinking of kids, but thinking of punishing teachers to work when it's very hot. And of course, they gotta like vaccinate the students. And someone mentioned, don't forget that youth under 12 years old can still get COVID, so outbreaks can still happen. Of course, some people happen to forget about that one. And of course, the air condition, the fan thing was also mentioned by a student, apparently, and who said apparently there's no air conditioning at school, and they can't even use fans, and when they go outside, there's barely any shade, hang in the shade, and and this person, I think she mentioned about having a safe summer and even safer September. So. And also the same person who mentioned under 12 can still get coronavirus. Yeah, also mentioned only 50% of people are like vaccinated, and I'll add to that too. Not only that, only a certain fraction of people are like fully vaccinated. and only a certain amount of people, up to 50%, have been got their first vaccine. Yeah, apparently some people, oh, my choice not to get a vaccine, so they're doing that. So that is the problem we have to endure right now, and yeah. And also, just to mention that too, another teacher also mentioned who was taught old schools and also new schools. Also mentioned there's no air conditioning and except for window units, and one school hardly had any windows and had and no air conditioning. So that sucks. And someone also tweeted something about sick kids experiencing a coronavirus outbreak on so, I wouldn't be surprised about that one. So I'm gonna go back to hospitalizations. So apparently 1,025 people are hospitalized with the coronavirus, an increase of plus 42. 692 ICU patients right now, so plus 5. Not good. And 498 ICU patients using a ventilator, plus 20. But lower than compared to April cases, hospitalization, so that's, I guess that's an improvement. So long-term care home deaths, finally the government stopped being shady and they shared it again. So 3,771 long-term care home deaths have been reported. Staff deaths have not changed since who knows when. Since May 15th, so that's like, yeah, it's been 10 days, and the 35 new outbreaks, so this is a +1, looking at the information, so yeah. So please follow coronavirus safety rules and regulations and stay-at-home rules. Please do not have any gatherings for the safety of others. And hopefully many people get vaccinated and cases go down and not through the roof. I'm getting vaccinated tomorrow. So Ian from the Ian verse, apparently he got vaccinated a few days before me, so glad you did that. So please stay safe. Do this for the safety of who knows who might get affected. And of course, don't forget that wave 4 might happen. Yes, it is a possibility. A bad possibility. So, just stay safe. Sign up for vaccinations if you haven't. And if, and hopefully, the Moderna vaccine is approved for use too, because we're only relying on a Professor BioNTech vaccine for use right now, but we need another one. And reports came in that the AstraZeneca vaccine is coming in soon. Coming back. It's coming back. Stay safe.